Hi everyone, I want to talk about heart failure causes. This is going to be the second presentation on heart failure. Kindly try the first presentation so that you can grasp everything that we're going to talk about now. And there will be more in future. So, causes of heart failure. Let's go. First of all, let's talk about the epidemiology. Heart failure is worldwide. 20 to 25 millions are affected worldwide. It's like about 8 in every 1,000 to about 60 in every 1,000 when we are comparing the different age groups. 8 over 1,000 if it's about people between the ages of 40 and 50, and 60 over 1,000 when we are talking about older people like 75, 80 and above. In other words, the older we become, the more the likelihood of heart failure. It is more in blacks, though it is worldwide. But when we put all different races together worldwide, it's more in blacks. It is found in everyone, every race, but more in blacks. It is either diastolic dysfunction, which is now known as heart failure with preserved ejection fraction, or systolic dysfunction, which is heart failure with reduced ejection fraction. Okay, let's go into details of the risk factors. Why is it important to know the possible causes or risk factors? Well, knowing the risk will afford you the opportunity to work against the risk, and it might help to slow down the rate in the population, and probably it may decrease the severity. Like I've just said a few minutes ago, increased age will give us the increased likelihood of having heart failure if we have other risk factors as well. Risk factors. Hey, genetics. Again, we are here. Genetics? Wow. Okay, we've inherited a lot of good things from our parents, but sometimes we do inherit all these troubles. And someone is saying, no, heart failure cannot be a genetic problem. It's not running in family. Wait, stop it. How about causes of heart failure that have clear-cut genetic predilection? So, yeah, traceable to genes. Coronary artery disease is the most common cause of heart failure, particularly in the Western world, while rheumatic heart disease in some other parts of the world. Coronary artery disease has genetic or familial risk factor as one of the non-modifiable risk factors. Okay, we're back at it. Genetics. Hypertension, for the same reason, it runs in families. Rheumatic valvular heart disease, myocardial infarction, part of coronary artery disease anyway, left ventricular hypertrophy, myocarditis, ischemic heart disease, arrhythmia. I've made a separate presentation on atrial fibrillation. I hope you're going to check that out now, about 5 different presentations on atrial fibrillation. Supraventricular tachycardia, ventricular tachycardia, ventricular fibrillation, a flutter, because while the heart is suffering, having arrhythmia, is not effective. The heart won't pump blood adequately. And the problem we are dealing with when it comes to heart failure is decreased tissue perfusion. The heart is not doing the job it's supposed to do, and arrhythmia could be a culprit. Other possible risk factors could be congenital heart defects, cardiomyopathy, and that is very horrible because majority won't even know that they have any problem until they have any reason to have X-ray done, and then they're going to see the massive heart there for some, idiopathic cardiomyopathy, peripartum cardiomyopathy, dilated cardiomyopathy. Ischemic cardiomyopathy is secondary to myocardial infarction, and that is very common in the Western or advanced countries, and that will lead to systolic dysfunction with impaired ejection or reduced ejection fraction. Risk factor will still continue with infection like HIV, infiltrative diseases, diabetic mellitus, smoking, anemia, obesity, and when we don't know the cause, we call it idiopathic. Risk factors: connective tissue disease, substance abuse like cocaine, heroin, amphetamine, and the rest of them will damage your heart. Doxorubicin, in fact, as far as those substances that I've mentioned are concerned, I've made separate presentations on them. Check out my channel for presentation on cocaine, amphetamine, cannabis, alcohol. Please check my channel. Okay, doxorubicin, COPD will lead to cardiopulmonary, alcohol, PAS, heart failure, renal failure, and of course, thyrotoxicosis. When you control all the possible modifiable risk factors, then leave yourself to whatever fate has for you, okay? But you have to control what you can control, like obesity, diet, diabetes mellitus. Get your treatment. Reduce alcohol, stop smoking. Don't go around substance abuse. When your doctors know that you are susceptible to heart failure or you've been diagnosed with it, they will take those doxorubicin off the table for you. Okay? Kindly subscribe to my channel so that you can get these presentations immediately they are published, because we are going to have series this time as far as heart failure is concerned, and I want you to follow from beginning to the end. The next presentation will be on diagnosis of heart failure. Thank you.